Welcome students. So today we are going to discuss about very important topic, that is our respiratory system, right? So starting off with the introduction, what is respiration? See, in the environment we have many gases, and for our system to work properly we require oxygen, and our body creates carbon dioxide as a waste metabolite. So what we want to take the oxygen inside, right, and we want to throw the carbon dioxide out. So the exchange of gases, that means we exchange some gases with the environment, right? So exchange of gases, that between the atmosphere and the lung. So what we do is we exchange the gases between what point? Between the atmosphere, lungs, blood and tissue, right? Why 4 systems are involved when we say respiratory? Only lung should involve. So what happens is that there is a lung which is giving the blood to the CV system. So blood vessels are coming and taking that oxygen via the hemoglobin, right? And it is going towards the tissue and giving it to them, right? And from where this oxygen or the gases are coming? From the atmosphere. So from the atmosphere it went to the lungs, the oxygen per se we are talking about. The lungs, from the lung it went to the blood. From the blood, whichever tissues are requiring that oxygen, we send it to them. What happened about the carbon dioxide? The carbon dioxide is created by all the tissues. So reverse will happen. From the tissue, the carbon dioxide, let's show it in the blue color, right? So from the tissue, the carbon dioxide went to the blood. From the blood, it flowed into the lungs, and from the lungs we exchange that into the atmosphere back, right? So that's how the exchange occur of oxygen and carbon dioxide. The ultimate goal is to provide oxygen to the tissues. Why? Because it is required in the energy production of the body, and remove the carbon dioxide. Why? Because it's a metabolic waste and it is not good for our body to accumulate this carbon dioxide, right? Moving on to the overview of the gases, what we talked about, from atmosphere we took the oxygen into the lungs, right? From the lungs we send it to the blood vessels, right? From the blood vessels it went to the tissues, right? And this blood vessel, that means nothing but your CV system is involved over there. So how it goes from the atmosphere? Once it comes into the lung via the alveoli, it get transferred into which vessels? Specifically, if we talk about from the alveoli, what happens is the blood vessels, I'll write it over here, blood vessels are coming. Which vessel? So whichever is coming, that is taking the deoxygenated blood. Remember, this is the pulmonary artery, right? So this is the pulmonary artery which is taking the deoxygenated blood. So this is the only artery in the adult life we have which carries the deoxygenated blood. And what happened? It moved and it gave the arteriole and the capillaries, right? And then onwards what happened? The capillary which connected to the pulmonary vein, right? So we do have pulmonary vein which carries the deoxygenated blood, right? And that's how it went to the left ventricle in your heart, right? Left ventricle, it went into the left ventricle, and left ventricle, what it does, it send it into the aorta. In this left ventricle, in between the pulmonary vein and pulmonary, the left ventricle, we do have atria. So let's write left atrium also. So left atrium to left ventricle, from the aorta towards the tissues, right? It went into the tissues, and from the tissues what happened is the again exchange will occur. Tissue will take up the oxygen and remove the carbon dioxide. So what happened? Again from the tissues the blood will come into the vena cava, right? Whatever veins are there, the veins collectively form the vena cava later on. So it came to the vena cava, right? From the vena cava what happens is superior and inferior, right? That will go into the right atrium, then it will go into the right ventricle, and again this will go into the pulmonary artery. So the circuits will go on and on continuously, right? So if I have to write it over here, I'll write it. So pulmonary vein, pulmonary artery. So the circuit will continuously goes on in our body, right? That is the gases exchange overview. What do you mean by pulmonary ventilation? You're doing ventilation means you're breathing, right? So there are two types of respiration. Actually, there are three types, but main two are the external respiration and internal respiration. What do you mean by that? If your respiration and exchange is occurring between the lungs and blood, at the level of respiratory system, that is known as external respiration. Why? Because it is connected externally into the environment. What do you mean by internal respiration? When the respiration happening within the blood and the tissues at the tissue level, which is not directly connected to the external environment. So that's why it is known as internal respiration. Then one important definition comes, that is cellular respiration. What do you mean by the cellular respiration? See, in the cells, various metabolic reactions are going on, right? When the metabolic reactions are going on, what the cell will do? Cell will use the oxygen, right? And what happens? It will create the carbon dioxide. So definitely the mitochondria is using the oxygen and it is combining that oxygen with the various nutrient, right? So combine oxygen and nutrient and convert that into the ATP. So whatever oxygen is used by the mitochondria and whatever carbon dioxide is released via producing the ATP, that is known as your cellular respiration. So these are the three different definitions, right? So we already discussed via the environment it will goes to the lung, via the lung and the circulation the oxygen will move, right? And oxygen will get deposited in the or taken up by the tissues for utilization of the energy, right? Or the formation of the energy, and whatever metabolite waste was produced in the form of carbon dioxide, that will be that will come into CVS again into blood vessels, and as soon as the blood will come near this alveoli and lung system, this CO2 will be transferred into the alveoli and ultimately it will go into the environment back, right? So what are the parts which are important for this respiratory system to do the external respiration, right? So nose and the nasal cavity, it's the first part, initial part from which the air will come inside. Then you have pharynx, larynx, trachea, bronchial tree, lung and the diaphragm. So these are the parts which are involved in the respiratory system, right? So over here you can have the diagrammatic overview. From the nasal cavity, the air will flow inside the body and that will go into the nasopharynx, then the nasal cavity into nasolarynx, then the larynx part main and the laryngopharynx, right? So it is moving via the larynx into the bronchi, into the trachea, then the bronchi, then the bronchiole, and ultimately it will go into your alveoli, right? Okay, so here is the division. A classification is done on this division, so that is known as Weibel's classification, that we'll study later on. Just remember what are the parts of this windpipe. This is known as windpipe. The major windpipe is called for the larynx, right? So from the larynx the air entered into the trachea. From the trachea the two main bronchi are there, right? The bronchi are again subdivided into bronchioles, right? And these bronchioles are again subdivided. So bronchi are subdivided into primary bronchiole, then the secondary, then the tertiary, and then the terminal bronchiole. Then the terminal bronchiole will continue into the respiratory bronchiole, and the respiratory bronchiole will continue into alveolar duct, right? And then into the alveoli. Okay, so over here we can see the alveolar duct. These are the alveolar duct, right? And these are the grape-like structures. This is the alveolar duct over here. You can see this one is alveolar duct, and what this part is shown over here as a grape-like structure. This is alveolar duct which is connected to alveoli, right? The round ones are the alveoli and the duct is known as alveolar duct. So as we were talking that there is a classification which is known as Weibel's classification. So what is that Weibel classification suggests? That there are functionally two zones, right? Which are the two zones? Conducting zone and the respiratory zone. So by the name what we get the terminology is conducting. That means it is causing the transport of that air, right? But it is not helping in the exchange, right? So what is the conducting zone? So you can see over here the conducting zone is written from the trachea till your terminal bronchiole. So it is written over here from the trachea till the terminal bronchiole, whatever divisions are there, that is known as your conducting zone, right? And the Weibel classification, what it suggests is, he gave the it was a scientist, he gave the numbers to this Weibel classification, right? That means the class the airways, he gave the generations, that means numbers to those generation or those divisions of the airways. So he called the trachea as a zero generation, right? And then as he moved downwards for the terminal bronchiole, he gave the number 16. So what we understand by this is that the conducting zone, if they ask, is nothing but the 0 to 16th generation, right? And he said that there are 23 generation in total, right? So what is the 23rd? It is the alveolar sac. So what when this transitional zone or respiratory zone started, it is started at number 17. So number 17 to 23, they are the respiratory zones, right? So what is the difference between this conducting zone and respiratory zone? Conducting means only transfer. So this conducting zone is only helping us in the transport, right? And the respiratory zone, that means it is causing actual respiration. What was the ultimate goal? To exchange the gases, to take the oxygen inside and to throw the carbon dioxide out, right? So that is what is done with the help of this respiratory zone. So this helps in the exchange of gases, right? And that is done by your respiratory zone. Moving on to the respiratory unit, it is having 5 components, right? If they ask about respiratory unit, the trachea, bronchioles, they will not come in respiratory unit. Respiratory unit means the one who are taking part in the exchange. So what are those parts? First is the respiratory bronchiole, then it will move down into the alveolar duct, right? From the duct, it is going to go into the antrum and alveoli, right? The inside part is known as alveoli, and these whole grape-like structures are known as alveolar sac, right? So there are 5 zones over here. You can see respiratory bronchiole, then it will go to the alveolar ducts. Alveolar duct will continue into the alveolar sac, and the alveolar sac is having many alveoli. In alveoli we have antrum. So these are the components of respiratory units. What is the function of respiratory system? We know there are some functions which are respiratory. That means it is helping in the exchange of O2 and CO2. But there are some non-respiratory functions also, right? The lungs not only does the function of respiration and exchange, it also do many functions of other organs also, right? What is the major function? Non-respiratory function, that is lung defense, right? So it is having its own PAM cells. We learned about that in the blood system, that the immunity system or macrophages are there inside almost all the cells. So which are present, the macrophages which are present in the respiratory system, we call them as pulmonary alveolar macrophages, right? That is nothing but your PAMs, pulmonary alveolar macrophages, right? What is the other function of lung? Humidify the air. olfaction, right? Then the vocalization. What do you mean by humidify the air? See, air can be dry, it can be very moistened out. So you have to check whether it is properly moisturized or not, right? Usually the air is dry, right? But the dry air cannot go inside easily. It will create some resistance. So in the nasal cavity itself, we have the mucosa layer, which is secreting the mucus. So it moistens out the air, right? And through that the air will go inside, which is having less resistance, so that it can go very easily down towards your trachea. Then olfaction, obviously the nose is there and nasal cavity is there, so olfaction means smell. So it is the air, whatever air is there, the molecules are there inside the air, it is going into our nasal cavity, and we do have some receptors over there which are sensing this olfaction, right? So it also do the function of smell. Vocalization. So without the air, you cannot speak, right? Try to close your nose and speak, the whole voice will change, right? If the air, how the sound is produced, the vocal cords are there. As the sound air is coming out through those vocal cords, what we do is the vibration that will be created at the vocal cord, and how the words are produced via the help of the tongue. So two things are helping, vocal cords and tongue, but they are doing it with the help of air, right? So that is the medium which is required always and always. So it is also helping in the vocalization. Then the bronchial secretions are there, which have the IgA and NO. What is this IgA? Immunoglobulin A. As it is immunoglobulin, that means it is also helping to fight the bacteria, right? And NO, that is nitric oxide, which is causing the vasodilation. So whenever it is required more, it will be secreted more through this bronchial secretion, and whenever it is not required, the secretion will be decreased also. And it prevents the foreign body from reaching to the alveoli. So it also have a mechanical format, how the trachea diameter is much larger, right? As you go down to the alveolar duct, the diameter also get less and less, right? So, and we do have cilia, which are nothing but a brush like structure which are continuously beating upwards, right? So what they do is, if anything foreign stuck into the mucosal layer, what they do, they beat upward and they will throw out the foreign particles, right? And PAM, we talk about, they attract polymorphoglucoside, that means they attract neutrophils, right? Which release proteases, and most of the bacteria and viruses, they are made up of protein, so it will help us to fight with those infections, right? Then coming to the pulmonary circulation. Pulmonary circulation is having some specific points. What are that? The pulmonary circulation, that means the blood that is coming to the lung, it acts as a reservoir of the left ventricle. Some blood can be kept reserved because the vessels of the lung that are very flexible. And what is the input of that? Whatever amount of blood is coming to the your right ventricle, that amount of blood is going to go into your pulmonary system. Why? Because they are attached in the series. So suppose this is the heart, right, and this is our lungs, right? So what is going to happen? So whatever amount of blood is coming into this right ventricle, that is all blood is going to go into this lungs, right? And what is going to happen once it is oxygenated? It is going to come back to the left atrium, and this is connected into the series, right? So one after another, so all the blood will go into the lungs, whichever coming to the heart, right? Then filter, it filters the small blood clot, fat cells and detached cancer cells and gas bubble, right? So whatever blood is coming over there, so in the blood there can be these things, so it can remove those things from the blood, right? And it also help in the fluid exchange and drug absorption. There are some drugs which are absorbed in the lungs if they have the receptor for that, right? And fluid exchange, that can be done in a little amount of fluid can be exchanged, right? Not the large one, but yes, that can happen in the lung circulation. What are the points to remember? This is a specific terminology which is known as eupnea. AIMS asked this question previous year. What is eupnea? Remember, it is nothing but the normal breathing. Eu means normal, pnea means to breathe. So wherever you heard this term pnea, that means to breathe, right? Eu means normal. The eu means normal. So eupnea means normal breathing. If we call this apnea, what will happen? If this pnea is same and we write it as apnea or apnea, so that means absence of breathing or absence or decrease in the breathing. Tachypnea, what do you mean by that? Tachypnea means increase in the breathing. Tachy means more, right? So tachy means increase in the breathing, right? So these are some terminology that you have to remember. Both the lungs contain 300 millions of alveoli. They do not ask you, but you have to remember that. And that's why whatever blood is coming, that is remaining there only for fraction of second, and still we are able to have the exchange. Then sympathetic stimulation to the bronchus, it is going to do the bronchodilation. We always say that sympathetic system is a fight or flight response. Fight and flight response. So suppose a dog is behind you and you are running quickly, right? So that means your skeletal muscle is activated, your sympathetic system is stimulated. What do you want? While running, you want more and more oxygen so that you can create more and more energy for your skeletal muscle to work, right? So you want more and more oxygen. So for that, you have to dilate, you have to increase the bronchiolar diameter, right? So that's what we are doing over here. The sympathetic stimulation causes bronchodilation, and when you are resting at your on your couch, so what will happen? You do not need that much of energy to rest, right? So bronchoconstriction will occur whenever the parasympathetic system is activated, right? Next point is the alveolar lining epithelium contains type 2 pneumocyte which are granular. So what is this? This point is very, very important. Why? Because if these were not there, the respiration would have been very, very difficult. Why? Because they act as a surfactant. The surfactant will reduce the surface tension. If the surface tension is decreased, that means the resistance. Surface tension is nothing but a tension which tries to collapse the alveoli, right? If the collapsed alveoli there, so while the inspiration, it requires much more energy to again get back to normal size, right? So what is the best example is the balloon. Whenever you blow the air into the balloon, if the balloon is whole collapsed, you require more energy to inflate the balloon. But whenever the balloon is somewhat inflated, you do not get that much of resistance to inflate that much more, to blow much more air. So it is always easier if it is already inflated. The similar thing happens in the lung and alveoli also. So if the surface tension is decreased, the alveoli will not collapse and it is decreasing our work of breathing, right? It decreases our work of breathing, or it decreases our resistance to get inspired. Then the pressures. Some pressures you have to remember. There are many pressures. Atmospheric pressure, the pressure which is there in the atmosphere, usually it is 760 mmHg. right? That is constant level, right? They will not change, so you have to remember that. The alveolar pressure. What do you mean by alveolar pressure? The pressure that is present inside the alveoli, that is known as alveolar pressure. Now the alveoli are only present in the lung system, or you can say pulmonary system. So if the pressure is present inside the alveoli which are present in the pulmonary system, so it is known as intrapulmonary pressure. This alveolar pressure is also known as intrapulmonary pressure. Then there is one other term that is known as intrapleural pressure. As you know, suppose this is the lung, right, and this is the hilus, right, through which the bronchi will enter into my lung. So what happens is, this lung is not alone, it is covered by a layer of pleura, right? But it is not only one pleura, there are two pleuras, right? So I'll draw it outer one, the whole. So the dotted pleura inside, that is known as the visceral pleura, right? And the line which is drawn outside, that is known as the parietal pleura. So they are nothing but the covering of the lung. Every organ is having their own covering, right? So lung is also having the covering of double layer. So the layer which is close to the lung, that is known as your visceral pleura, and the layer which is outside of that pleura is known as the visceral pleura. You can see over here that there is a gap between these two, right, pleura. What is that gap is known as? That gap is known as the pleural space. This is known as pleural space, right? So the space between the visceral pleura and parietal pleura is known as pleural space. Now there is important law is there to understand all these pressures and volume changes. There is a law which is very useful, that is known as Boyle's law. What this Boyle's law states, it states that more the volume will be there, less pressure will be there, and less the volume will be there, more pressure will be there. So in fact what it states, that volume is inversely proportional to the pressure. Volume is inversely proportional to the pressure inside the respiratory system. So whenever the volume is going to increase, the pressure will decrease, and vice versa will occur. So that what we said. So whatever pressure is created by the alveoli inside the lung, that is known as intrapulmonary pressure, right? And whatever pressure is created in the in between the pleural space, that is known as intrapleural pressure, right? This is the outer one is the parietal pleura, you can see over here, and the inner one is the visceral pleura. In between that we have pleural space. So whatever pressure is created in that pleural space is known as intrapleural pressure. Intra means inside, pleura means pleural cavity. So intrapleural pressure which is generated inside the pleural cavity. Now the pressure, if you compare the pressure inside the pleural cavity and inside the pulmonary cavity, that difference is known as transpulmonary pressure. That difference is known as transpulmonary pressure. Usually it is 4 mmHg. So these are the lungs, and the bigger muscle which is shown in the orange color at the downside, that is known as your diaphragm, which is responsible for 75% of your inspiration. So it is a larger chunk which is the work which is done by this diaphragm, that is 75%. How this inspiration occur and how the volume of the lungs get increased, right? Let's see that. What happens whenever you want to inspire, what happens is the intercostal muscles, which intercostal? External intercostal. So external intercostal muscle, they will contract, and what will happen once they contract? They will elevate the ribs and sternum. Ribs is elevated, sternum will flares up. That means if suppose this is the normal expiratory phase. If the ribs are elevated and the sternum will go up, what will happen to the anterior-posterior diameter? That will increase, right? So whenever they contract, the anterior-posterior means this diameter will increase because of that. And not only that, the diaphragm moves inferior during contraction, right? So diaphragm, so second muscle is diaphragm, and what we just talked, that this diaphragm is responsible for 75% of that, and the rest 25 is contributed by this external intercostal muscle, right? So diaphragm will move downward. So what will, suppose this was the lung volume first, if the diaphragm move downward, what will happen to the superior inferior space? That is also increase. So like this also increase, and in the direction up to down is also increase. So overall volume will got increase. And what the Boyle's law suggests, if the volume, we are saying that because of increased space, the volume got increased. So what will happen to the pressure? The pressure will decrease, right? The pressure become negative now. Now this negative pressure will suck the air inside, right? Why? Because it is directly connected to the environment, right? So what happens is that in the environment, suppose this pressure goes down to -2 to -6. Suppose this pressure inside the lung goes down to -2 to -6, and in the environment it is a 0 mmHg. Remember 760 which I told you, that is the actual pressure, right? And the 0 which we are talking, that is the relative pressure. So this is the -2 and -6 is also relative pressure. If you have to write down the actual pressure in terms of the intrapleural pressure, that will be your 758 to 756. Sorry, 754 will be there. You just have to subtract whatever amount of numbers is given over there, right? So we will talk in terms of the relative pressure only. Why? Because it is much more easier, and in the books it is usually used the relative pressure. So outside it was 0 and inside it is negative. So negative pressure is much less, right? And what the concentration gradient or the pressure gradient say? If there is any gradient, it might be chemical, it might be pressure, it might be volume, it might be the intrapleural pressure. So what will happen? If the pressure is high somewhere and pressure is low somewhere, the pressure will try to balance itself, and that's why the air will move from the atmosphere inside the lungs, so that to balance the pressures, right? And as soon as the air comes in, what will happen? The pressure become 0 mmHg into the lungs also. If they ask what is the pressure at the end of expiration, then you have to tell 0 mmHg. They ask before the inspiration or during the inspiration, what is the pressure? That must be in negative, that is -2 to -6. The opposite thing is going to happen in the expiration. What is going to happen in the expiration? The reverse thing, right? Now the alveoli are stretched too much. Now they cannot, they activated a reflex which is a stretch reflex. As soon as they stretch, they try to relax or come closer again, right? So that is what is happening. Remember, in the expiration, the normal expiration is passive process, right? It happens because the intrapleural pressure is increased now, right? And what we want to do is the alveoli creates the surface tension, right? Once they are stretched, the stretch receptor is activated and they want to recoil, right? The alveoli is the elastic structure. What do you mean by elastic structure? Whenever you take a elastic band, what happens, whenever you stretch the elastic band, it creates much more resistance and it wants to get back to its normal size. The similar thing will happen with the alveoli also, right? It is the elastic structure, so whenever it got stretched during the inspiration, it tries to come back, that is known as recoil, right? So in the normal expiration is passive because of the alveolar recoil, right? But whenever you need to do the active expiration, suppose you are exercising, right? You are running on the treadmill, right, on the faster speed, what is going to happen? More and more oxygen you will be requiring, right? At that time, what happens? Your respiratory rate will be higher, right? So you take more and more oxygen inside. Your tissues are also working, so they must be creating more and more CO2. So you have to throw out the CO2 at the same level. So you have to use the extra energy, and that is used by the internal intercostal muscle. So remember, whenever excessive requirement is there, so the expiration become active. So expiration is active in the active process, right? Whenever the excessive amount of CO2 is there in the body and we have to throw it out, right? So in that environment, what is going to help us? Majorly the internal intercostal muscle. They are going to contract, the internal intercostal muscle, they will contract, and there are some accessory muscles also that we will talk about. They will contract. What they cause is, they cause the decrease in the lateral diameter. How? Whenever we talk about, even in the passive, in the rest position, let's talk about that first. The diaphragm will move upward, right? The diaphragm is also a muscle. It got stressed during the inspiration, it came down during the inspiration. Now it wants to go up back, right? So it goes up back. So the above to down diameter will become normal again. So what the external intercostal did, they inspire, as soon as we inspire, they contract and make the lateral diameter from left to right increase, right? As well as the anterior posterior diameter via increasing the rib cage, via moving the rib cage upward, as well as the sternum anteriorly, right? So they increased both anterior posterior and lateral diameter. Now they want to come back to their normal size and normal position, so they will come back to their normal position. So everything will be decreased. The anterior posterior diameter also decrease, the lateral diameter also decrease, and the above downward, that is superior to inferior diameter, is also decreased. So that's why everything is coming back, and alveoli is also recoiling. So what will happen? The air will throw out, and this process is increased with the help of internal intercostal in case of activity, right? That active activity, like during the exercise, that is also known as force breathing, right? So in force breathing, which are the muscles which are muscles of nostril, which are known as elanesi, right? Round glottis that may contract, right? Aid the entrance of the air to the lung. So these are the muscles which helps in the inspiration also and expiration also, right? The extensors of vertebral column, they can help to push the the movement of via the movement of the spinal cord, right? Muscles of the neck, that is sternocleidomastoid muscle and scalene muscle, right? Then the elanesi of the nose, they are all accessory muscle. Now internal intercostal helps in the majorly in the expiration. It does not help in the inspiration, but yes, that will be activated only and only in the forced breathing, not in the normal resting condition. Then the abdominal muscles are there, right? They also contract. They actively aid in the ascent of the diaphragm. That also helps in the expiration, right? What are the factors those influence the pulmonary ventilation? There are three factors which influence. First is the airway resistance. If airway resistance increases, what will happen to the pulmonary ventilation? Pulmonary ventilation will decrease, right? And whenever the surface tension, this is also a form of resistance that we talked about. If the surface tension increase, again the pulmonary ventilation is going to decrease. What about the lung compliance? The lung compliance is because of the surfactant. Lung compliance, that means how much it can distend, how much it can stretch. So it is actually helping us into the breathing, right? So it is directly proportional to the pulmonary ventilation. That means if this compliance increases, the pulmonary ventilation also increases, right? And the glucocorticoids, if you give glucocorticoids, they are going to go and stimulate this surfactant. So what is going to happen if we give, if the surfactant level is less in the patient, we can give them glucocorticoids. What is ventilation perfusion ratio? This is an important term that is known as ventilation perfusion ratio. This is the ratio of alveolar air ventilation to pulmonary blood flow. What do you understand by this name? Ventilation. That means breathing, right? That means how much air is coming towards the lung upon, this is denoted as VQ ratio or VP ratio in some books, right? So what do you mean by that? V is denoting how much air is coming to the ventilation. V for ventilation, it is denoting how much air is coming to the lungs. And what do you mean by perfusion? It means the blood flow. So how much blood, the Q is nothing but the perfusion, how much blood is coming to the lung. Simple, how much blood is coming to the lung and how much air is coming to the lung, right? So usually, normally, how much it is? It is 0.8. It is 0.8, right? If it got increase or decrease, it is known as VQ mismatch. It is known as VQ mismatch if the level is increased or decreased. What is the normal level for that? A normal level is 0.8. If it is more than 0.8 or less than 0.8, it will be known as VQ mismatch.